Got it from ABC.
Guys, first we're gonna take a look at the heart from the outside. So try to, not that picture, just go under. Yeah. Move on. All right, make sure you put that, I don't know what page is it.
450.
450, look from the outside first. And then once we get to the outside, then we're gonna open up, go inside, which is that page that you already had before, okay? And the first thing whenever you wanna do the dissection of the heart is that first you have to establish the right and left. And if you establish the right and left, it makes everything much easier, okay? If I was going to look at the heart from the outside to establish which side is the right, which side is the left, as you recall from the lecture room, we said that we're going to take a look at the anterior interventricular artery or anterior interventricular sulcus. See this shallow groove right here is in the front. That's the reason they call it anterior. And inside this you have the anterior interventricular artery, which of course they did not put the dye, you cannot see. See that you have to have a contrast either. So there's no injection on this stuff, okay? But if they would have put the injection, then you will see the anterior interventricular artery right here. But in any case, that's the anterior interventricular sulcus, and you see in the front goes diagonal. See it? Whereas in the back, posterior goes straight up and down. You see that? So that's the posterior, and this is what? The anterior. Now, once you establish this, then to the right side of it, would be what? Right. To the left would be what? Left. Of course, that is if you know right and left, right? Okay. So again, remember, guys, this is based on anatomical what? Position. Understand that? So this would be the right, and this would be what? The left. So this is the right here. This would be the right. That's the right side, right? Because I established that's the anterior interventricular sulcus or artery. So that's the right. Here's the left. So this is the right what? Right atrium or right auricle. Yes? That earlobe block. You see it like an earlobe? Okay. Right atrium or right auricle, and this is the right what? Right ventricle, and this is the left atrium or left auricle, and that's the left what? Ventricle. And this is the apex, the pointing part, and this is the base right here. Now, guys, bring that model of the heart. Can you put it on the things, stand and put it right here for so that way you can. Okay. If this is the right atrium or right auricle, which blood vessel goes to the right atrium? Superior what? Superior vena cava and what?
And inferior.
Inferior vena cava. Yes?
Yes.
You study for your lab quiz, right? Yes. Supposedly, huh? See, this is the right atrium, and here is the superior what? Superior vena cava or superior vena cava, and this is what? This is the inferior vena cava or inferior vena cava. See that? So the superior, yes, and what? Inferior. Going to right atrium, and from right atrium to right what? Ventricle. Which vessel goes out of right ventricle? Goes out of the right ventricle. Which blood vessel goes out of the right ventricle? Pulmonary artery or pulmonary trunk, right? Okay. So this is the right ventricle, yes? And that's the pulmonary what? Trunk. That's the pulmonary trunk or pulmonary artery right here. Because that's the right ventricle. So that's the pulmonary artery or pulmonary. It's the pulmonary trunk, yes? Which later on branches to pulmonary what? Rather than pulmonary
arteries.
Pulmonary arteries. Right? From the right there. And then goes to lungs and pick up oxygen, comes back as pulmonary what?
Veins.
Pulmonary veins into left what?
Left ventricle. I mean,
Atrium.
Left atrium. So that's the left atrium, yes? That's the left atrium, and these are the pulmonary what? Pulmonary veins. See that? Pulmonary veins right here. pulmonary veins. And that's the left what? Left atrium. And from left atrium to left what? What blood vessel goes out of the left ventricle? Aorta. So that's the aorta here. See how large it is? So that's the aorta. Okay. In fact, that's the arch. Remember, first is the ascending, where the coronary arteries branch. Yes. And then the arch. Here's the arch right here. And what was the first major branch in the arch?
Brachiocephalic.
And that's the brachiocephalic right here. That's the brachiocephalic. So that's the aorta, which is a little bit larger, so that you can. That's the aorta, and that's the brachio what? And then they have already cut the rest, so you cannot see. So you can see up to what brachiocephalic at least. So the right atrium or right auricle with the superior and what? Inferior cava. The right ventricle, pulmonary what? Trunk or pulmonary artery. Doesn't matter. Pulmonary trunk or pulmonary artery right here. And then pulmonary what? Veins with the left what? Left atrium or left auricle. Left what? Left ventricle. And then what? The aorta with the brachio what? Cephalic. That's how much you can see from the outside. Once you cut open, go back to that picture that you had. What you need to do, once again, in the lab practical or whatever, you need to first establish the right and what? Left. And from the inside, if you remember from the lecture room, we said what we're going to take a look is that we're going to look at the first, we can look at the septum. Like here's the interventricular what? Septum. To the right would be right, to the left would be what? Left. Yes, that's one way. But if you forgot your right and left, we said we can take a look at what? The thickness of myocardium. See, compare the thickness of myocardium in this side as opposed to this side. See that? So that tells me that that's the right and that should be what? The left. So there are two ways you can do that, but you know. So this is the right, and remember this goes together, right? So that's the right, and look at the thickness of myocardium. This is the left, look at the thickness of myocardium. See that? And that's the left. Now, if this is the right, so that's the right atrium, and in fact part of the auricle is right here. The right what? Atrium, and that's the right what? Ventricle. Yes? And then this is right here, and between the right atrium and right ventricle, what kind of atrioventricular valve? Tricuspid. So that's a tricuspid. You see how it makes it easy if you know the right and left? And so that's the tricuspid, which is connected to the cordia what? Tendineae. See that? The cordia tendineae. And then that's the papillary what? Papillary muscle. So the papillary muscle with the cordia tendineae and what? Tricuspid. Tricuspid because it's the right side. Okay. Here's the left atrium, yes? Yes. With the left what? Ventricle. And between left atrium and left ventricle we have what? Here's the bicuspid valve or mitral valve. And then that's the cordia valve, tendineae, and these are the papillary valves. Papillary muscles.
So this is the atrium?
This right here, yeah, remember, I guess part of it is right here. This. So that's the, see, that's the left auricle. So right here. Right here. So this would be the left the atrium, and that's the left what? Ventricle. Okay. See, in order to see the semilunar valves, like from here, from the right, remember, here's the right ventricle, that's the pulmonary what? Trunk. See that? Pulmonary. Really, if you wanna, you have to, I don't want to do that. I mean, you have to cut all of this. Yes, so that way we can see the pulmonic semi what? No, because remember, this is that's the pulmonary artery, right? Which goes to the right what? From the right ventricle, right? This is the right atrium, remember? That's the right, and that's the right what? Ventricle. And then if you really want to see the the pulmonic submarginal valve, then you have to what? Cut this. We don't want to do that, guys. As it is, they have already. Okay, but take a look. Let's see if we can at least see the aortic submarginal valve. See, here's the aorta. Yes, and remember that was the brachial what? So the aorta. So remember, this is the left what? Ventricle, correct? And then the aorta goes out, right? So this right here, at least we can see the aortic submarginal valve. No, remember this is the bicuspid mitral valve, but this stuff right here would be what? I guess they didn't do a good cut, but this would be the aortic submarginal lunar valve. Okay, but that's the aorta right here, right? Isn't it the aorta? Right. Okay. Because see, it goes like this. See that?
Yes.
That's the left ventricle. It goes like this. See that? The aorta and the brachial. Okay. Just go to the lab and study. Okay.